Welcome to the program today, ladies and gentlemen. Thank you so much for your time, and of course, wishing you a very lovely weekend. Today, we want to discuss fever in children, and of course, this is one of the key issues that affect every child when they are growing. Just from their early years up until their later stage in their life. Now, how do you deal with a fever? How do you know that your child has got a fever? And what is a fever? Those are some of the things that we want to discuss today. And of course, my guest on the program today is Dr. Kevin Zimba, who is a pediatrician consultant from Matero First Level Hospital, who is here to educate us more on this particular topic of discussion. Dr. Zimba, welcome to the program today.
Well, thank you. Good afternoon, Nelson.
Good to have you once again.
It's great to be back.
Exactly. And of course, for your contributions, you'll be coming through on 0955 5016, 0955 5016. You can simply send us a text in case you have got any question, any query, any observation. And if you're a mother, if you're a father, and of course you have got an infancy, you've got a child, and perhaps you're not sure about something, well, you can take advantage of this particular platform and, of course, be able to engage Dr. Zimba, who will be here to respond to your queries. To start with, first things first, what is a fever?
What is fever? So fever basically is an immune response by the body, which we measure with a thermometer, basically a temperature. So fever means that somebody has a temperature above the normal range. So the normal range of the fever depends on where you're measuring it. That's the normal range of the temperature. Depends on where you're measuring it. The most common site that would measure is the armpits because of its easy access and able to do. So normally fever is temperature that is above 38 degrees Celsius. So normal body temperature will be between 36.5 and 37.5. So a fever is a temperature that is above the normal body temperature.
Why do children get fevers?
So fever is one thing that not only children get, but many people, even adults, do get the fever. So fever is the body trying to react and telling you that there's something wrong. So the fever is also a way of stimulating the body's immune system. So when somebody develops a fever, it helps the white cells come up so that person's immune system can now begin to fight. So you notice that also the most common causes of infections are like bacteria and these viruses, and they have a temperature at which they survive. Beyond that temperature, they get destroyed. So a fever is the way of the body trying to protect itself from these organisms. When the temperature rises, it tries to kill off these organisms, and the body can defend itself. It's also trying to indicate and say there's something really wrong that needs to be attended to. Okay. So it's a defense mechanism, basically.
So every time that a child has got a fever, the assumption is that there is something wrong with the child.
Exactly. So it means that there's something wrong, but it's something that you also get to know that there are several causes that can cause the child to have a fever. The most common are infections. So infections can range from a bacterial infection, which can be anywhere. It can be a viral infection, which can be anywhere as well. And then it could be the body reacting and telling you that there's something wrong, or what we call autoimmune. So this is where the body begins to fight itself and develops some system. So it could be an autoimmune, or it could be that somebody has taken some drugs inside and therefore is getting that fever to do that.
What are some of the basic symptoms of a fever in a child?
So fever itself is a symptom. So a fever is a symptom. You normally get the fever either by using a thermometer or by touching. So it's a symptom you get. Then you find that children who have a fever will be less active. So this is a child who's been playing all along, and today this child is just not active, is a bit drowsy. They'll complain to you that they have a headache. They may have a running nose. They may have a lot of several things that go around it. But the most common thing you see is that the child will be less active. They may have a headache. Sometimes they may be even diarrhea, or passing urine frequently, and even fast breathing. So those are the things. So fever itself is a symptom to tell you that there's something wrong and it needs to be evaluated for us to know what is there.
How common are fevers among children, and do they depend on certain age groups?
Okay. So fever is one of the most common reasons why parents or guardians bring their children to the outpatient clinic. because you see a child when they touch a child, they notice that this child has fever, and they'll come. So it is common. You'll find that between 70% of our outpatient presentations will either present with a fever as one of the symptoms. It may not be alone, but as among the other symptoms that are there, fever would be one of those that would be there. Fever in children is one of the things that tells you there's something wrong with the child. And like we know, children have special needs based on the various age groups that they are. So you will find that a baby who's less than 6 months who presents with a fever, that fever has to be treated differently from a baby who's 2 years old who just presents with a fever. A 6-year-old, less than 6 months who presents with fever, most likely there's something serious with the fever. That patient needs to be taken to the hospital as soon as possible so that we do evaluate that is what's wrong with that child causing fever. So in short, there are several causes of fever in the children.
Interesting. When you look at the response that parents usually take when their child develops a fever, I don't know whether those responses are recommended. For example, getting some sort of a painkiller, giving it to a child. It could be paracetamol or maybe Kafinol, or maybe even just getting any other home remedy, any herbal, give it to a child, or maybe get a wet towel and of course pat on the body of the child and so on and so forth. Are those recommended?
Yes, some of them are recommended. Some of them are not recommended. So home remedying, like I've said from the beginning, fever is essentially something wrong. So home remedying is just basically to make the child comfortable so that the fever comes down, and then we take the child to the next level so that the evaluation is done to see what is causing the fever. So home remedies that can help prevent a child the fever, that can bring down the temperature, that do not treat the cause of the fever. From the word go, we need to find out what the cause of the fever is for us to treat it. So the fever can be brought down so that you get the next level. And one of the things that are there are things like tapid sponging, where a mother can just undress the child who's overdressed, the fever will go up, just undress, light dressing, the temperature will come down. A warm bath. So remember that it's not dipping the child in the cold water that makes the temperature come down. No. It's a warm bath. As the water is trying to evaporate and everything, it takes some heat away with it, and the child's temperature comes down. There's also what we call tapid sponging, where we can get a wet towel and just tapid sponge on the child. That will also help reduce the temperature. If we are going to go to use pharmacological methods like using paracetamol, like you said, we must use paracetamol, and it must be according to the prescribed dosage in the pack. Because remember, overdosing is a problem. And then one important thing we need to remember is that we don't use aspirin in children anyhow. It has to have a good indication for us to use it because of the common side effects of aspirin. Paracetamol is a safe drug to be used to lower temperature, and so long as we use it at the right dosage. Aspirin we should not use. So those are some of the home remedies that we can do, and whenever we do that, we must take the child to the next level to be seen. And then what will happen when they go to the next level usually is that there's usually a nurse in the outpatient center who will see which patient needs to be seen first, which patient needs to not to be seen first. So they will do the vitals, take the temperature. If the temperature is very high, they will then bypass you to see the next doctor or give you some paracetamol so that you can be seen so the temperature comes down.
So at this level, when should a parent take a child to go and see a doctor?
Okay. So the first thing I must say, what are the causes of the fever? So a fever is that there's something wrong with the child. A child who's below 6 months and develops a fever should be taken immediately to the hospital, because there's most likely going to be a bigger reason why this child has fever. And those are children will not even say give paracetamol to lower the temperature down. A child who's 1 year, 2 years, we can give paracetamol to lower the temperature down and take the next facility. So all the time a child develops a fever, it is recommended that they do take a child to the hospital. So when you look at, I've brushed around and said what are the most common causes of fever. I've been generalizing. A child who's playing, active and the like, and then suddenly develops fever, there are about 5 major reasons why they'll present with fever. In Zambia, we'll look at malaria. Although our goal is that we eradicate malaria before 2021, malaria is still one of the things that causes a fever. Pneumonia, which is a lung infection, will be one of the things that will cause a fever. Ear infections, the otitis media is one of them. Just a common cold will be another reason. The acute tonsillitis, the tonsils will be another reason, and the urinary tract infection. So when the child presents to the hospital and they are seen, all these 5 key areas will be examined to make sure that it's none of these, because all these are preventable and treatable. They are treatable, and death from this is very much preventable. But you notice that the most common causes of fever in children are actually viral, and most fevers will respond within 48, 72 hours. The temperatures would have settled and gone away. But it's important for a clinician to examine and decide which patients he's going to treat and which patient is just going to give paracetamol to bring that treatment down, because that can be a decision between life and death.
How is a fever diagnosed?
So a fever being diagnosed, the tool that we use to diagnose fever is a thermometer. So the most places you can, the most reliable place of getting a proper body temperature is the rectum, where we push the thermometer and do that. But then it's uncomfortable, and you need several thermometers around for you to keep doing that. So the other one we use is the digital thermometer, where you can put it in the armpit and do that. Now with advancing technology, we're using the infrared thermometers, where somebody just points, more like like the previous used speed guns, just points, and then it will give them a reading. So that's using a thermometer. In settings where we cannot have a thermometer and we're at home, we can use just the body, the touching. And our mothers are quite experienced at that. Most of the time, a mother will come and tell you this child has fever. When you touch yourself, you also know that there is fever. When you do the temperature, the thermometer, temperature is high. So the tool that is recommended is a thermometer, but you can also touch to make that. But the touching requires experienced hands, and when you do it several times, you'll get to know this is what this child has a fever, this one doesn't have a fever.
One of the key questions that most parents usually ask is, why is it that, most children tend to have, fevers late during the day? You'd find that sometimes from morning, afternoon, the child will just be active very well. But as you get into the evening, late at night, that's when now you would find that the child now, the body temperature changes, and of course, it develops that fever. Why is that so?
Why is that so? So first of all, is that what do children want to do? Children want to play. So even if they're not feeling well, they'll drag themselves and be up and about playing and everything. And unless it's really quite bad, then the child will sit and stay. So you find that towards the evening, when now the child is trying to rest and everything, the hormones and there are things that what you call how do I describe it? So there are things like hormones that are released in the body that go and trigger the body controlling the temperature. More like they trigger a switch in the brain called the hypothalamus. This is what regulates the temperature of the body. So there are hormones that are produced somewhere that say there's something wrong, then they are carried through the blood and go to the hypothalamus and say, increase the temperature to this much so that you can protect the body. So there's that change in the balance. So you find that because the child was active and everything, masking all those, now that the child is calm, relaxed, and trying to sleep, then the temperature spikes and causes it. So it's basically just the way children carry themselves out. They're quite active, and so they'll only show those things towards the evening when they're rested and no longer want to play.
All right, so today we are looking at fever in children, and of course, basically we're looking at what really causes a fever in children, how often is it, how common is it, and of course, when are you supposed to go and see your doctor in case your child has got a fever. And according to Dr. Zimba, any child who is 6 months and below, whenever you notice that their temperature is not okay, is high, make sure that you take them for professional medical checkup, because there the period is quite delicate. Maybe when the child is above 1 year or 2, yes, you may actually do the tapping and all that tapping and probably you can put up a few home remedies and perhaps maybe get paracetamol or anything, but you also need to avoid giving your child aspirin as well. I think that point Dr. Zimba did make it very clear. Now, let's say a parent brings a child to the hospital. What are some of the recommendations after the diagnosis is made? What are some of the recommendations that you usually give? Okay,
so the fever is just one sign and symptom. So, like I said, it can be caused by either 5 things. So, if they present to me, we'll do a malaria test. If it's negative, we don't treat for malaria. If we find malaria, we'll treat for malaria. Then the malaria is what actually causes. We'll look through the ear. We'll look through the throat and see what's on the throat. If we find that the tonsils are inflamed, then we need to treat the tonsils that are there. If you have a running nose, we'll give symptomatic treatment and relief, because we know most common causes of running nose is just a viral treatment, and then it tends to resolve on its own. So just some paracetamol, some saline nasal drops will help for them to get that relief. Then we'll do a urine test when possible to collect a urine. So remember that children, some below the age of 3 years, most of them won't say that they want to pass urine. So we have to there are special techniques of collecting the urine. But for those who easily say, I want to pass urine and everything, you send them to the lab and do a urinalysis and see. Then we'll do a full blood count. So a full blood count will point to us at the beginning whether this is a viral infection, whether this is just a bacterial infection, and will tell us, oh, okay, it's just a viral infection, supportive treatment, and the patient will get better. If it's a bacterial infection, we see a lot of high white cells, and the neutrophils especially, then we may need to add an antibiotic, and then some paracetamol, and see how the patient responds. Most fevers within 72 hours are settled. But I must say that there are also very serious causes of fever, like meningitis, which the patients will stay in hospital for a longer time to receive IV antibiotics for a minimum of 7 to 14 days. For some cases may even go 21 days of antibiotics. So what has to be done when a child develops a fever is peculiar to the condition that has caused the fever. So fever is only a sign of something wrong, and there could be several causes of the fever.
So for a father who've got a child, whenever their children or their child has got a fever, they should not look at it as a sickness, or should they look at it as a disease?
So fever itself is not a disease. Fever is a sign of something wrong. So then whatever is causing that fever is what is the disease. For instance, if there's an ear infection, we'll say it's otitis media. So otitis media is what has caused that fever. So if there's a tonsillitis, we'll say it's tonsillitis. If it's malaria that has caused that fever. Fever is a sign telling you there's something wrong. The best analog I'll give you is when you're driving a car and then you get an engine check on your dashboard. So that just tells you that the engine needs to be checked. It doesn't mean the whole engine has a problem. So when you go onto that diagnostic machine at the mechanics, he will tell you, oh, probably it's the airflow sensor. Probably it's this that has got the problem. Then you treat that. Similarly with fever. Fever is just a warning sign to tell you, hey, my friend, you need to get checked. There's something wrong. And then fever is also a defense mechanism for the body to protect itself. When you develop fever, it now triggers the immune system to say, hey, can you start defending yourself? There's something wrong. When it goes up, it's also one way of killing the germs that are causing that problem that is there. But then it can also go wrong with just when you get an autoimmune problem where the body starts fighting itself and you start developing fever as one of the things. But usually that is fever that lasts more than a week plus or so. Fever that just starts suddenly and lasts even 2 days is not probably an autoimmune problem. Probably there's either an infection somewhere. But I must say that the most common infections are viral infections, and most of them are self-limiting. The question that will come up usually most of the time is, why do children get more fevers than adults? So you will notice that between the age of birth and 7 years, most children tend to have a lot of these infections that are there. So first it begins with the children trying to build up their own immunity. These children have, the first 6 months basically depend on the mother's antibodies, which they got when they were in the womb. But now they are born and they now begin to develop their own immune system. So as they are growing older, they're trying to develop an immune system that is similar to that of an adult. And by the time they're 7 years, that's when they get an immune system that is almost similar to that of an adult. And you will notice that the fevers reduce. For those that start, the moment the toddler starts attending kindergarten, they will have at least 3 flus in a term. Although some parents even feel like withdrawing their children from school because of all those fevers and that they do get. But it's just a process of a child developing his own immune system. And they do get out of it.
All right, so 0955 5016, 0955 5016. That is the number that you're using to interact with us. Dr. Zimba is here to answer a few questions from you that you might have in relation to fever in children as well. Just for now, we go for a break. When we come back, we want to look at how can you prevent your child from getting a fever, and is it viable when a child is growing to prevent frequent occurrences of fevers? Is it viable that you can do that? What are some of the mechanics that you can put in place to protect your children from a fever? For now, we go for a break. Keep those text messages coming, and of course, we'll be getting to them shortly.
Why does it have to be standards?
It's the same as a guy is gonna come back to his friends. No, I slept with this girl, and that girl, and that girl, and
She's such a gay.
No, for him, it's a gay.
He's not even a G, he's a stupid boy.
Yes. How is he a stupid boy?
Listen, why would you brag about?
Let me tell you. Always have an excuse.
Men are usually awarded for their nonsense.
3/4.
That's
You
what
think so?
it is.
You think so?
I know so.
Okay. All the best. Now, that's it.
So I can literally get into your house and tear it down because I ran it.
Yes.
You owning it.
Girl,
Nothing.
Listen. No.
If
I
I'm
think
back to
no.
your house,
These
you
are
own
ills
a
we need
house,
to
I
correct.
ran it.
So what?
I can-
You're saying guys don't know how to cook? No.
I don't think she
Like
learned that
you're a guy out
literally.
there and you don't know how to cook. Please get my number. Guys, no.
She's advertising yourself.
Are
you Jeremiah, are you single?
Yes, boss. We have 3 women on the show and 2 guys, but you still know we got it.
Exactly.
For the best hospitality and serene environment, welcome to Chipata TV Lodge. We have spacious air-conditioned rooms, English breakfast, a well-stocked bar, and sumptuous meals for you to choose from. We also provide venue for your conferences or weddings. So next time you are in Chipata, think Chipata TV Lodge. Chipata TV Lodge.
Kings are born and not chosen. In one kingdom, the first generation, where people are happy with a lot to celebrate about. But when the first chief in Sofwa dies, it's the playful grandchild who takes over, Chief Muzo, and the palace is turned into a common house. Chief Muzo rules.
I am the king.
There is drama.
You are going to marry these 3 women.
If he was here, I could have stabbed him to death.
All right, so welcome back, ladies and gentlemen. Let's quickly get to our text line. A good number of messages are coming through from all across, and of course from people who are definitely watching us. Thank you so much if you're one of the participants as well. All right, so we'll start with this one from obviously Eastern Province. It says, good afternoon, Dr. Zimba. Just one of the causes of fever, that is malaria. Is it true that one can have malaria 3 to 4 times in a month? Mr. Life from Kumawa, Eastern Province.
Okay. So, thank you very much. Malaria is one of the most common causes of fever in children and even in adults, and is one of the most common causes of mortality, of course, of deaths in our country. We are trying to get rid of malaria and eradicate it. So one of the ways of eradicating malaria looks at prevention of disease itself. That is vector control, end-resistant spraying, sleeping under a mosquito net, and use of insecticides. So if someone is not using insecticides or sleeping under a mosquito net, and they keep getting bitten, they'll get malaria quite often than not. Then secondly, is that coming to his question, of having malaria 2-3 times in a month, it's the mode of diagnosis that we need to be looking at. What are we using to make a diagnosis? Is it the RDT or the microscopy? So if we've confirmed with the microscopy that there is malaria on all those 3-4 time visits that is coming, yes, then it's possible. But if we're using the one method like the RDT, which may remain positive even 2 weeks after the first treatment of malaria, it may not be malaria that is having 3 times, but 1. But we need to make sure that is looking at the preventive measures for the malaria from getting it. So it's possible to get malaria frequently, but let's look at how to prevent malaria. And when the diagnosis is made of malaria, is the treatment has to be completed so that we avoid resistance, and then we prevent him from getting other diseases, getting the malaria again by sleeping under a mosquito net, insecticide-treated mosquito net.
Okay, so now if at all a child is put on malaria treatment, under what circumstances can it bounce back?
So so long as you're sleeping in a place where you're going to be bitten by a mosquito again, which is infected with malaria, you get treated. That treatment finishes, and then you get another infection with malaria. So if you get treated and you're sleeping in an insecticide-treated net, you're not getting bitten by mosquitoes. You will not get malaria, provided that you finish the treatment that we're giving. The current treatments we're giving are very effective. The coartem and the artemether-based regimens are quite effective for treatment of malaria. So if you are treated and sleeping under a mosquito net, the likelihood of you getting malaria again is not there. But so long as you are bitten with a mosquito with malaria, you can get malaria several times. And Eastern Province has a good number of malaria cases currently in the country.
Okay. All right. This one is coming through from somebody in Mpolongo. That is Mr. Mwale from Mpolongo. He says, Doctor, my observation on the causes of a fever along the shores of Lake Tanganyika is Mpuku or Ilonda. That being the case, we as Zambians need to do a research on diseases that are in areas like Mpolongo. In this case, maybe I might as well want to refer you to what you just said on Eastern Province. Exactly. Could also this be the case for Mpolongo? Because it's along the shores of obviously a lake or something?
Okay. So you notice that Zambia has been put into 3 regions basically, like in terms of malaria control. So you have regions like Lusaka where we are almost, I would say Livingstone, where we are almost there. We've eradicated, there's no malaria in Livingstone. Then you have regions like Lusaka that do get malaria from people who travel outside. Then you have regions like Chipata, Mansa, Mpulungu itself, where it's coming from, where malaria is endemic, and that's where we've intensified our goals in terms of trying to eradicate malaria. The question there, he says, Ilonda, from, pardon my Bemba or not, what I understand from Ilonda is a skin rash that is there, and the most common, it's a fungal skin rash, and that fungal rash does not really cause a fever.
Okay.
It persists for some time, and normally it's caused by contact.
Okay.
And then like fungi are quite difficult to treat most of the time. So those patients will probably go to a clinic, they're given a topical antifungal, it clears off a bit, but because they've not gone the full duration, it keeps coming back. And it's quite common in places where you share clothes and in close contact. I don't think it's the most common cause of fever. We need to do and find out what is causing fever in that area, but most likely I'm certain we would find malaria to be among the top causes of fever in Pulungu.
Okay. Hi doctor, which type of fever is more dangerous?
Okay.
So here, I don't know whether fever has good types.
So there are several types of fever. So but then now that becomes just medical jargon to put and everything. So there are fevers that one gets today and will last maybe 2 weeks plus or so. It will be going today, 37, comes back, resolves. Others will last 3 days, intermittent. Others will go, when you start treating, it drops and things like that. But that's just medical jargon. So fever is just basically temperature above 37.5 degrees in somebody who's got a problem. So fevers depends on what is causing it. So for instance, if you have sepsis, that's more dangerous. If you have meningitis, that's dangerous.
Okay. Yeah. Interesting. All right. This one says, is there any home remedy for fever, or what should someone do before taking the child to the clinic? Kalolo, see Chililabombwe. I
So-
should think so, yes.
Okay. So I don't know that it's a Mr. It's Mr. Karolo.
No indications
Okay,
here.
so Mr. Karolo in Chawombo. So the first things we can do is light dressing. You can remove some dressings on the child that is there. Then we can do tapid sponging. We can get a first towel, put on the forehead, and then remove it and do that. Or we can give the child a warm bath and do that. If we have some paracetamol at home, we can give paracetamol. When we buy paracetamol, it has a leaflet inside that tells us what we're supposed to give as a dose, per se, and then we take the child to the hospital. Because at the hospital, so they will evaluate and tell us whether it's what kind of infection is there that needs to be treated or what is causing the fever. So those are some of the things we can do at home that is recommended. We don't give aspirin like I've said it earlier on, Mr. Kalo.
Okay. Okay, so Mr. Kamtaeni, thank you so much as well for being part of the program. All right, so now let's talk about the prognosis of fever in children.
Okay. So prognosis, most fevers in children are limiting. Within 3 to 4 days, the temperature should have settled and the child should be fine. The challenge is for the children who are between 6 months and 6 years, who are likely to have what we call a febrile convulsion. So these are children who, because the fever goes up so rapidly, goes above 38.4, they're between 6 months and 6 years, have no other problems with the brain that can explain that, and start fitting because of the fever. It's quite common and it's quite frightening for parents. Those are just called febrile seizures. And most of those seizures, people outgrow them. They are common in families. So if somebody in the family has had a history of fitting when they have a fever, they are likely to fit again, to have a sibling who's going to fit when they do have fever. So most of the fever is self-limiting. The one that worries most parents is where it gets to a febrile convulsion, and they do that. And then if the infection that is causing it is severe, then the prognosis may be quite bad. If it's autoimmune, we have to treat the autoimmune prognosis. But in a nutshell, prognosis of fever in children is quite good if we find what is causing it.
Okay. Actually, I'm glad that you've even brought in the issue of convulsions here, because my next question was, can a fever lead to convulsions in a child, and how should a parent react when a child starts convulsing?
Okay. So fever can do that, and like I clearly said it, so it's common in between the age of 6 months and 6 years. Temperatures that are rising rapidly up to 38.4 and above can cause that. Somebody who's had a fit before can fit again. The most common causes, the most types of those fits last less than 15 minutes, and they're usually jerking of the whole body. So those are the ones that we call the typical febrile convulsions. So when that happens, the first thing that the parent is supposed to do is make sure that the child is safe. You don't try and restrain or make sure or move the child or move other injurious objects that are around the child. So the child is safe and the child fits. Most seizures will limit themselves and stop. Then we can take the child to the hospital. And the important thing is to time the duration of the seizures, because a seizure that is lasting more than 5 to 10 minutes requires intervention for it to be stopped and done that. So there's no need for you to hold just turn around the child, and after fitting, we can put the child in the left lateral position. So they're made to lie on the left side, so that they prevent aspiration. And no need to give some feed soon after, so that because you can cause aspiration while the child is fitting. So it is a common thing that it can happen.
Gift from Kit want to find out, does teething cause a fever?
Okay, so teething does induce some form of immune response that can strike a fever. But at the same time, when the child is teething, remember teething is around the age of 6 months, 9 months going onwards. This is the time the child becomes a bit more active. They tend to get the objects from the floor and put them into the mouth. They tend to put their hands into the mouth because the gums are a bit itchy. So they tend to also develop an infection, and that's why you find that most children will develop a diarrhea at the same time when they're teething, because as they're putting things in the mouth to soothe their gums, they develop an infection and get that fever. But teething itself also can induce an immune response, resulting in the temperature to rise.
Okay, interesting. Well, Dr. Zimba, somebody here wanted, just away from the topic of discussion here, somebody just wanted to know exactly the meaning of your title itself, a pediatrician. So I didn't want to be the one to explain, so I thought maybe you could actually be the best person to explain. This is from a Massiva from Coco. Pediatrician. How broad is the profession itself?
Okay, so a pediatrician is a doctor. So first you're a doctor, you do the training. In Zambia it's a standard 7 years training. After that 7 years training, then you go do a master's degree in pediatrics and child health. So this is a doctor who has just gone and specialized in seeing children. We are all doctors first, then we specialize just to see children. We go do a master's in, it takes 4 years in our country to do a master's, but in some countries and the current setting that we have, it takes 3 years for you to specialize and become a pediatrician and do that. So a pediatrician in short is a doctor who's specialized in seeing children.
Okay, so Mr. Massive, hopefully you got that one correct. Okay, so pediatrician is a person who is, or a doctor who is, in fact, not just a person, but a doctor who is specialized in children's health. Okay, so when you take a child to the hospital and they refer you to, not to a nurse, but to a doctor, just know that that doctor to whom you have been referred to is a pediatrician. He is specifically trained to look at the health of children as well. So this program is specifically dealing with children's health as well. Okay, that is all we actually look at. Okay, so this one says, why do babies have fever and diarrhea when they are teething? What makes them to have fever? Okay, so now something that I've come to understand is there is a lot of questions that parents usually have on teething. In the previous episodes, I think we've made it clear. I think, you know, when Dr. Marsden came here, and of course when Dr. The other doctor from Dr. Amadi, when she came here, one of the points that they emphasized on is the fact that teething does not cause diarrhea.
Yes.
Exactly. So now I think there has been a lot of confusions in terms of understanding just that basic concept of teething. But why is it that every time a child is teething, diarrhea definitely, they become susceptible to diarrhea?
Okay.
So let me take this opportunity maybe to ask you again to explain the chemistry.
So I think like Kelly said, teething alone will not cause diarrhea.
Mm-hmm.
So it just basically tells that there is an infection that is there and causing the diarrhea in the child itself. So now, what are the possible ways of the child getting the infection? So this is a child who it so openly coincides that is teething, and because the gums are quite painful, as the child is trying to soothe their gums, they tend to touch the ground, put the mouth to soothe their gums. At that age, this is the age when whatever objects they get on the ground, the first thing they do is the end in the mouth, about 6 months. So they'll get the end in the mouth, and then they're getting infection from there and putting it into the gene. You notice in some settings that when they have a child in the house, you don't even walk in with your shoes in the house. And all those are safety things that occur just in the environment. You leave your shoes at the door, you walk in because it's a child who's crawling. So that environment is basically just kept clean because they know the child, whenever a child will get something and put an object in the mouth and get an infection. Not necessarily that the teething is the one that is causing the diarrhea, but the child has gotten an infection that is there. The infections can be either from the source of food, the water, or the objects the child is playing with as they're putting the things in the mouth. So that one is it's a big myth. With grandmas there, it's quite difficult to get, and you explain it, but they'll come and tell us. And usually we believe our grandmothers.
Hopefully that this one has made it. Hopefully that this one has come out clearer. I know, you know, even the previous explanations were clear, but you know, where myths, traditions, and of course modern, you know, knowledge is concerned, you'd find that when somebody for so many years has been entertaining a certain belief, and now you're told to say, okay, this is not the way it is, but this is how it is, it becomes difficult for people to respond quickly. I'll give you a typical example. Last week we were discussing, you know, delayed speech and language. Yes. And one of the key things that my experts emphasized on were the fact that, you know, there's that, you know, exactly, the Tantai Akalimba, exactly. Dr. Marsden and of course Rolene, who came through last week, you know, they made it clear that, you know, the Tantai has got very little to do with delayment in speech. But now look at what we've been entertaining for so many years. And stuff like that. So now, you know, when there is a change of that, and it becomes very difficult. So I'm sure that even in the next few episodes that we're going to look at, the tongue-tie definitely will come through in our discussion, trust me.
Yes.
All right, so we go to Chingola. Okay, this one is coming through from Opeta. He says, can we be able to stop fever by giving a child cold water? Maybe as we will respond to this, we can as well talk about some ways in which we can prevent fever.
Okay. So if you give cold water, so the thing is that if you drink cold water, yes, you feel cold. But by the time the water gets to the stomach and gets to the intestines, the water will get back to body temperature. So it per se won't bring the body temperature to being cold, to bring down. Fever is a sign, and that usually starts with the switch that regulates the body temperature. The hypothalamus. Basically, it's like a thermostat of the body. So when your body temperature gets 37.5, it switches on to make sure that your body temperature cools down. It will tell you either to sweat, either to do this, either to do that. So now, when you have a fever, the set temperature for that to kick in is set higher. So even if you drink cold water, you have a fever, it will not come down because the set temperature is there until we find out what is causing that fever. So drinking cold water will not really prevent the fever. What we can do to prevent fevers starts with immunization per se. So remember that we should no longer be looking at curative medicine as the way we should go. Preventive medicine is more helpful and more cost-saving. So one of the preventive ways of preventing infections is by immunizations. So children who are fully immunized have less chances of getting infections and will have less chances of developing fever. Hygiene, personal hygiene again is quite important. Simple basic things, hand washing, do prevent a lot of infections. Just hand washing with soap and water is good enough. If you don't have soap, hand washing with just water itself is about 80% good enough. Avoiding overcrowding places. So that one also now comes to most creches, nursery schools and primary schools. You find in one class there are 50, 40 children. There's a lot of, it's overcrowded. In the cold season, windows are closed. There's a lot of cross infection that will occur there because of the close contact and overcrowding that will do that. So in a nutshell, those are the basic things. And then now we can also add nutrition. So good nutrition as well prevents infections. So you notice that a child who's malnourished will have several infections, and they'll do that. And then we can prevent that. And then the common things also need to talk about all the time. We talk about is HIV. So a child who keeps getting recurrent infections needs to be tested for HIV or another primary cause of the immune system to have a problem. There could be several causes why the immune system is not okay other than HIV. So those are things that we need to be putting. And once you put them on treatment, we stop all those things, and it becomes a less cost to the family.
I think this question is quite vital here. Is it okay to give painkillers to a baby after receiving vaccine to reduce temperature?
Okay, so that practice has been a growing trend now, where you find that when a child goes for immunizations, they're given some form of paracetamol to reduce. They're given paracetamol per se. It's a low dose, a start dose to reduce the temperature. So vaccines basically act like they are supposed to mimic and make the body react the way it would react when there's an infection. That's the only way. So a good vaccine is one that makes the body react exactly the same way that an infection does, and then the child develops the immune system towards that. So normally they will be given just to calm them down, and the fever from the vaccine will not last more than 24 to 48 hours. That should resolve.
Interesting. Great. Okay, so we have barely about 6 minutes, Doc. So within that 6 minutes, what's the connection between, Rains was trying to find out what's the connection between convulsions and a fever, because when we bring in the issue of convulsion, we make a fever seem to be a very serious, medical condition.
Okay.
Uh-huh.
So there, I'll put it in two to three groups of people, or babies. So there are babies who have a problem with their brain. Okay. So for instance, this child has cerebral palsy, or this child has hydrocephalus and has a shunt in it. When this child develops a fever, a child who fits. When this child develops a fever, this child is likely to fit more than any other child. Okay, so these ones are called seizures with fever. Then there is this child who's between 6 months and 6 years, who has a family history probably of having somebody who fits when they have fever. This child who doesn't have any other reason why this child should fit, but just has a high rapid in fever, they are likely to fit. So those ones will be called just febrile convulsion. So there is that link that will be there. Then there's a child who has an infection that is affecting the brain. And then because of that infection affecting the brain has a fever, this child fits. And that one now has a reason why he's fitting. Probably it's a meningoencephalitis or just a meningitis that is fitting. So sometimes the fits may be because of the various things that are surrounding the child, and the fever comes and goes there. But yes, there's a link between seizures and fever, and commonly are febrile convulsions. And febrile convulsions, I must say it again, that most children outgrow them. By the time they're 6 years or so, the issues of fitting when they get a fever tends to disappear. And the ways of preventing them, there are only about 2-3 ways of preventing those children who fit when they get a fever. There are only about 2-3 ways of doing that. And mostly we prescribe them to a specific number of type of children who fit with fever. Not everyone that we do that.
All right, well, Dr. Zimba, thank you so much. Let me let go of you for now. I know, obviously, you need to rush back to the hospital, but thank you so much for your time, and of course, hopefully that you will be able to have another discussion with you.
No, it was a pleasure. I'm looking forward to coming back again.
Definitely. Thank you so much. All right, so ladies and gentlemen, that's it for today. So we're discussing fever in children. Thank you so much to everyone who participated on the program today. We had messages from all the way as far as Kalomo, Mpulungu, Ndola, Eastern Province, within Lusaka, and of course other parts of the country as well. Thank you so much for your support. Hopefully that Dr. Zimba has been very, very helpful in tackling this particular topic today. We'll be back next week Sunday, same time, as we'll be discussing another aspect of a child's health as well. And of course, remember to stay glued to this particular program as we bring a different pediatrician from different first level hospitals, from UTH, Matero, and of course others as well, just to come and educate us on how we need to handle the health of a child as well. I've been your host, Nelson Zulu. Until next week, it's bye-bye and God bless.
Why does it have to be standards?
It's the same as a guy is gonna come back to his friends. No, I slept with this girl, and that girl, and that girl, and
she's such a gay.
No, for him, it's
he's not even a G. He's a stupid boy.
Yes.
I'm honest.
How is he a stupid boy?
Listen, why would you brag about?
Let me tell you. Always have an excuse.
Men are usually awarded for their nonsense.
3/4. You
That's
think so?
what it is.
You think so?
I know so.
Okay. All the best. Now, that's it.
So I can literally get into your house and tear it down because I ran it.
Yes.
You owning it.
Girl,
Nothing.
Listen. No. I think no. These are ills we need to correct. So what you're saying, guys don't know how to cook? No.
I don't think she
Like
learned that
you're a guy out
literally.
there and you don't know how to cook. Please get my number. Guys, no.
She's advertising yourself.
No.
Are you Jeremiah, are you single?
Yes, boss. We have 3 women on the show and 2 guys, but you still know we got it.
Exactly.
We bring you the best music videos, all genres, every day 12 hours to 13:30 on your favorite channel, QTV. Ngoma.
Ngoma, every day 12 hours to 13:30.
We love local. All of your favorite Zambian hits. And much more. Z Rampage, Fridays 9 to 12 on QFM. For the best hospitality and serene environment, welcome to Chipata TV Lodge. We have spacious air-conditioned rooms, English breakfast, a well-stocked bar, and sumptuous meals for you to choose from. We also provide venue for your conferences or weddings. So next time you are in Chipata, think Chipata TV Lodge. Chipata TV Lodge.